Welcome to Raaonline. Hi all, I am Dr. Savita, Physiology faculty. Today in this session, we'll talk about the regulation of heart rate. As we all know, sinoatrial node is the natural primary pacemaker. The rate of discharge of this sinoatrial node is going to reflect the heart rate. The normal heart rate is around 60 to 100 beats per minute, which is higher in newborn, whereas it declines with age. If the heart rate is going beyond 100 beats per minute, this is called as tachycardia. There are various physiological as well as pathological causes for this tachycardia. As far as physiological causes are concerned, exercise is one of the major cause for it. Pregnancy and emotional factors like anxiety as well as in children. Pathological causes are fever. Fever increases the heartbeats by 10 beats per minute for every degree of Fahrenheit, and it increases by 80 beats per minute for every degree of Celsius. And the other pathological causes include anemia, hyperthyroidism and hypersecretion of catecholamines. If the heart rate is less than 60 beats per minute, this is called as bradycardia. Again, there are various physiological as well as pathological factors for this bradycardia. Sleep as well as trained athletes do have bradycardia, and the pathological causes include hypothermia, hypothyroidism, Addison's disease, enteric fever, myocardial infarction as well as heart block. So why there is a need for this cardiovascular regulation and why the cardiovascular system has to be regulated? The first point is the blood supply should be increased to the active tissues, especially during exercise, to the cardiac muscles as well as for the skeletal muscles. And second one is the redistribution of blood to increase or decrease the heat loss from the body as per the requirements, which can cause cutaneous vasoconstriction or cutaneous vasodilatation. And third thing is to maintain the blood flow to the vital organs like heart, kidneys or brain, because these organs cannot withstand ischemia even for a few minutes, and they had to be given blood supply at the cost of other circulations. So the fourth point is during stresses like excitement, fear, anxiety and change in posture. So all these 4 points we need for the cardiovascular regulation. So how this cardiovascular system is regulated is one by the regulation of the cardiac performance and second by the regulation of the performance of the blood vessels. So how the cardiac performance is increased or decreased, that is depending on 4 factors. One is the chronotrophic action, which is the effect of the heart rate. That is, the heart rate can be increased or decreased, that is called as the positive chronotrophic action or the negative chronotrophic action. And the second one is the inotrophic action, which is the force of contraction, that is the effect of the force of contraction of the muscle. So again, this can be positive inotrophic action or a negative inotrophic action. And the third one is the dromotrophic action, which is the conduction of the impulses, that is the effect of conduction of the impulses. Again, this can be positive dromotrophic effect or a negative dromotrophic effect. And finally, the bathmotrophic effect, which is the effect on the excitability of the cardiac muscle. Again, this can be positive or negative. And the second one is the regulation of performance of the blood vessels, and how this is done is by the alteration in the diameter of both the arterioles and veins. Now today in this session, we are going to focus only on the chronotrophic action, that is the heart rate. So how the heart rate is controlled neurally, that is a neural regulation of the heart rate, can be seen in elaborate in this session. So these are the 4 important components how the neural regulation of heart rate occurs. One is by the higher centers, second one is the medullary control centers, third one is the autonomic nervous system, and finally the reflexes. We'll see one by one what it is. So we'll talk about the medullary control centers first. So there are 3 areas in the medulla, that is the vasomotor area, nucleus ambiguous and the nucleus tractus solitarius. This vasomotor area is otherwise called as the sympathetic center. Nucleus ambiguous is otherwise called as the parasympathetic center, and finally the nucleus tractus solitarius, which is called as the relay station. The vasomotor center is otherwise called as the medullary sympathetic center, and this is the prime cardiovascular regulatory center which is present in the medulla. These are the group of neurons which are present bilaterally in the reticular substance of the medulla in the floor of the 4th ventricle. There are 2 areas in this vasomotor center. One is called as the pressor area, the other one is called as the depressor area. So here is the vasomotor center located. This is a vasomotor area which is located in the medulla. The pressor area is otherwise called as the vasoconstrictor area or the cardioaccelerator center. And this is located in the, we call it as RVLM, that is the rostral ventrolateral medulla. This area contains the glutaminergic neurons, which will have an excitatory effect on the spinal sympathetic neurons, which are present in the thoracolumbar region of the spinal cord. Normally, the neurons present in this pressor area, they'll fire continuously, that is, they have got some inherent tonic activity, so that they discharge impulses rhythmically and continuously, and this continual firing is called as the sympathetic vasoconstrictor tone, which will be spread to the entire body through the sympathetic vasoconstrictor nerves. And this sympathetic vasoconstrictor tone is very essential to maintain the partial contraction in the blood vessels, that is called as the vasomotor tone. So, whenever the pressor area is stimulated, it causes vasoconstriction, increase in the heart rate, and increase in the force of contraction. The other area is called as the depressor area. Again, this is present in the vasomotor center. So, this is situated bilaterally in the caudoventrolateral medulla. This is called as a CVLM. And this is also called as the vasodilator area. Whenever this depressor area is stimulated, the sympathetic activity is decreased because this area is going to inhibit the pressor area. So, this is going to inhibit the continual firing of the neurons present in the pressor area. So, whenever this depressor area is stimulated, this causes vasodilatation, decrease in the heart rate, as well as decrease in the force of contraction.